Hi, this is Dr. Jonathan D. Hall coming to you from Boston with a talk today on non-surgical correction of the aged face. I'd like to call this a master class and 10 principles for success. Over the years, I've uncovered some principles that I find are very helpful for my patients who are seeking facial improvement without surgery, and I'd like to share them with you in this brief video. Patients come into my office almost every day with the wish to look better, and they'll often suggest to me a treatment that they think will help. Like everything else in medicine, it's best to make a diagnosis before we start selecting a treatment. When it comes to looking better, we need to first understand the typical changes that occur with aging. Then we need to make a treatment plan, a roadmap to success. The first principle then is to stop and analyze the face, to make the diagnosis before we choose a treatment. We used to think that aging was gravity pulling on the face, but with time and study, we discovered that as we age, we are losing volume in the face. This may be fat, bone, and muscle. So we lose facial volume as we age. The forehead deflates with aging. As the brows drop, we subconsciously activate our frontalis muscle to pull the brows back up and get lines in the forehead. The brows deflate. Botox can be used for the central forehead lines and volume replacement to the brows and lateral forehead lines. The cheeks deflate, giving a hollow look under the eyes. As the cheeks drop, we see a deepening of the nasolabial creases around the mouth. Some patients call this the parentheses. Marionette lines develop at the corners of the mouth as the cheeks continue to deflate. The artist rendering does not show it here, but the corners of the mouth also tend to turn down. The good news is that this lost volume can be replaced. If we're going to the operating room to perform a facelift, I'll do fat grafting to replace the lost volume. I call this lifting and filling, but not everyone wants surgery, and off-the-shelf volume is available in the office. As many of you know, I am a proud alumni of the General Surgery and Plastic Surgery program at the University of Michigan. Another important principle is that the product we use must be reversible. When I was a resident at the University of Michigan, a study was being done in a condition called Romberg's hemifacial atrophy, where a lupus-like condition where fat in the face goes away and causes volume loss in the face. This could be corrected with liquid silicone injections and looked like it was working quite well. But now, 15 years later, which is when I'm starting with my residency, we would see these patients back that had these injections, and they'd have granulomas and chronic infections and problems. And that taught me a very valuable lesson, that any filler that we use should be reversible. We should be able to remove it if there's a problem. I still occasionally see in my office today patients who have had liquid silicone injected in their lips or their face by non-medical practitioners. In this country, Artefil and Belafil are approved by the FDA. This is a mixture of collagen and small plastic granules. The idea is that as the collagen gets absorbed, scar tissue forms around the plastic spheres and leads to some thickening. But this is not reversible, and in Canada, nearly half of the patients that had it in their lips developed granulomas. So permanent fillers have permanent complications, and it's better to use something different. My favorite fillers are the Juvederm family from Allergan and the Restylane family from Galderma. These are non-animal stabilized hyaluronic acid fillers. The acronym is NASHA. And we have hyaluronic acid already in our bodies. The filler is not made from animals. It's made by bioengineering bacteria in a test tube, and it's long lasting. It lasts up to 2 years in some parts of the face. The good news is it's reversible in the rare case of a problem. We can dissolve it with an enzyme called hyaluronidase, which we keep in the refrigerator. Now, there are other fillers that get absorbed with time, such as Sculptura radius, and they're not permanent, but they're also not reversible. And for that reason, I don't typically recommend them for my patients. So again, the most common fillers that I currently use in my practice are the Juvederm family from Allergan and the Restylane family from Galderma. It's sort of Coke versus Pepsi because they both work well in different areas. So I was invited to be a guest injector at a seminar a few years ago in the downtown Boston, and the organizers said something that stuck with me. They said that the different fillers and the neurotoxins are really just a set of paints, that it's the artist that holds the brush who is the most important. And that really stuck with me, and I think that it's important, if you're going to undergo facial rejuvenation, that you find someone who is really experienced in understanding and treating facial aging. which is usually a plastic surgeon. Ask yourself who is holding the brush, not who has the cheapest set of paints. Another principle is we need to focus our efforts to achieve a good result. It's not usually possible or practical to treat every sign of aging at once, and not everyone wants to or has the budget to treat all of the signs of aging. We need to focus our efforts on the areas that are going to give the most noticeable improvement and treat those areas first. Malcolm Gladwell wrote a book called Blank, in which he builds a case that spontaneous decisions are often as good as or even better than carefully planned and considered ones. I like to glance at somebody's face and notice what are the aging deformities that are the most noticeable that stand out at a quick glance. Those are usually the ones to focus on and correct first. When we interact with others, we focus on and around the eyes. It is common for someone to come in and ask about their neck or lips because that's where they're looking in the mirror. But when we look at each other, the eyes have it, and improving the aging changes around the eyes and middle face are usually the most important priority if someone wants to look younger, less stressed, and more rested. So another principle is to plan on enough volume to finish the job. If your room needs 2 coats of paint, you can't start with a half a gallon. You need enough to finish the job. When it comes to facial aging, it is important not to overcorrect, but it is also important to use enough volume to achieve a noticeable improvement. We don't have to correct every problem at once or fully correct every problem. When we're planning surgery, we generally want to correct something as completely as possible. But with non-surgical improvements, we focus our efforts on the low-hanging fruit, the areas that are going to give us the biggest improvement. As long as each step makes an improvement that is worth it, then patients are happy. So I strive for an improvement with every step. Like the tortoise and the hare, slow and steady wins the race. Many patients love looking better with each step without a sudden drastic change. This is also a good way to avoid overcorrection and the risk of creating an unnatural appearance. So a quick review. Number one, the diagnosis comes before the treatment is selected. Permanent fillers have permanent complications. The artist who holds the brush is more important than the set of paints. We need to focus our efforts to achieve an improvement. We should treat the most noticeable signs of aging first. Improvements around the central face tend to be the most rejuvenating. We should plan on enough volume to finish the job. I should strive for an improvement with every step, and slow and steady wins the race. The final principle is that the best treatments, whether surgery or non-surgery, look natural. Friends and coworkers know that you look better, but they're not quite sure why. My patients will come back and tell me that their friends or coworkers complimented them and asked if they had been on vacation. Another common compliment after facial treatment is, "Did you get your hair cut?" These are my biggest compliments because it means that my patient looks better, but the results are so natural that others are not sure why. So they assume that it must be something that we commonly do to look better, such as a new haircut. So I have 2 case studies today, patients I'd like to show how I've applied these principles to achieve a nice and pleasing improvement. Our first patient is a woman in her early 60s who came in complaining about an aged appearance. When we glance at her face, we see that her eyebrows are flat, giving her a sad appearance. She has significant volume loss of the midface, which contributes to her looking older and almost unhealthy. Botox can be used to shape the eyebrows, and Restylane Lift and Juvenin Voluma can be used to restore volume in the midface and restore the prominence of the cheek. Here is a result that we were able to achieve with a few non-surgical treatments in the office, giving us a step-by-step improvement to reach your goal of looking less tired and more youthful. The Botox has shaped the eyebrows. The Lift and Voluma have restored a natural, more youthful appearance to the cheeks. The lips are subtly enhanced. The oblique view shows the natural improvement. The cheek volume of youth is restored. The lips are subtly fuller and the corners of the mouth are turned up. In the side view, we can see the volume loss of the cheeks and the improvement after treatment. Now, interestingly, she does have a little looseness in the neck skin, and some patients might come in and say, "Can you do a facelift?" But you can see we've really restored a rejuvenated appearance and youthful appearance without doing surgery. Botox also weakens the overactive crow's feet muscles around the eyes, the orbicularis oculi, to reduce the overactive lines when smiling. Here's a woman in her later 40s who's bothered by a tired look. With a quick glance, we notice deepening of her forehead lines, volume loss of the cheeks, and deeply etched dimple lines around the mouth. Here is a result that we were able to achieve with a few treatments in the office, working on a step-by-step improvement until we reached her goal. So how do we do it? Well, Botox arches the eyebrows and relaxes the forehead lines. The Botox is placed to the central forehead, not the lateral forehead. The lateral frontal muscle pulls up the lateral brows like a window shade. We generally do not want to put Botox in the lateral forehead because it will drop the eyebrows down. The remaining lateral brow lines could be treated with Restylane Refine, but they're not bothering her. Juvederm Voluma and Restylane Lift correct the volume loss of the midface. Over a few treatments in the office, we were able to restore a youthful volume of the cheeks without overcorrecting. Restylane Define is placed to the deep dimple lines, lower nasolabial crease area. It is a flexible filler and does not bunch when she smiles like traditional fillers might. The overall change has been remarkable. This has been Dr. Jonathan D. Hall from Boston reviewing 10 principles for success in non-surgical facial rejuvenation. Now our last patient wanted to tell you about her treatments in a brief video clip. How are the fillers working out for you?
I absolutely love them. They've made a huge impact in how I feel about my appearance. They've made me look less tired, less haggard. I look refreshed. The only thing people comment now on me is if I changed my hair, which is very nice.
That's awesome. And what do your friends say when they see you?
They don't even notice it. That's how subtle it is. And again, they will compliment me on my hair. They'll ask me if I highlighted it or did something different with it. It's so subtle. I still look like me, but as Dr. Hall always says, I look like the best version of me.